Today in this video, I am going to explain ribs. If you find helpful in this video, please like, subscribe, comment, and share my channel. Let's go to the video.
Today I am going to explain about the ribs. Human has 12 ribs. We all know
Classification of rib.
according to the articulation and according to morphological. I already write here according to the articulation with the sternum. Ribs are classified into true ribs and false ribs. True rib is from 1st to 7 ribs and false rib is remaining 5 ribs. That is from 8 to 12 ribs. But 7 and the 12 ribs are known as floating ribs. Why they are called floating ribs? Then come to the morphological classification. In morphological classification, there are typical and atypical ribs. Typical ribs is from 3rd to 9 ribs, and atypical ribs is from 1st, 2nd, 10, 11, and 12 ribs. In this video, I will explain about the typical ribs. First, come to the side determination. Here is typical ribs. It is left typical ribs. A typical rib has 2 ends and a shaft. Posterior end and anterior end, which is cup-shaped depression, and a shaft. Here, shaft. Now come to the feature of the posterior end. At the posterior end, there is presence of head, neck, and tubercle. In the posterior end, there is presence of head, neck, and tubercle.
Head.
In the head, there is presence of 2 facets. Upper smaller facet here, and a lower larger facet here,
Neck of
And
ribs.
Here is neck. Neck has 2 surfaces, anterior surface which is smooth and posterior surface which is rough, and 2 border, superior border which is thin and inferior border which is rounded.
Tubercle.
There is presence of tubercle at the junction between neck and the shaft. Here is tubercle. It is at the junction between neck and a shaft.
Shaft.
This is shaft of the rib. Shaft has upper and lower border. There is upper border here and lower border here. Upper border is thick and the lower border is thin, and it has 2 surfaces. Outer surface here, this is outer surface, and inner surface here, inner surface. Now I will show you the muscle attachment of typical ribs.
Attachment of head.
In the head, triradiate ligament attached on the head, and on the crest of the head, intra-articular ligament is attached here.
Neck.
Neck has 2 surfaces, posterior surface and the anterior surface. Anterior surface is smooth and which is covered by costal pleura. Posterior surface is rough and there is presence of inferior costotransverse ligament here. Inferior costotransverse ligament. In the crest of the neck, you will find costotransverse ligament in the crest of the neck.
Attachment of shaft.
At the angle of shaft, thoracolumbar fascia and supraspinalis muscle attached here. At the medial to the angle, levator costae muscle and the sacrospinalis muscle attached here. And now comes to the anterior end of the shaft. At the anterior end of the shaft, now come to the anterior end of the shaft. At the anterior angle of the shaft, in case of 5th to eye rib, there is origin of external oblique muscle which separate from serratus anterior muscle here. Here separate the origin of external oblique muscle from serratus anterior muscle from 5th to 8th ribs. In case of 9 anterior rib, separate the origin of external oblique from latissimus dorsi here. In case of 5th to 8th rib, separate the origin of external oblique from the serratus anterior muscle. SOaF, which has upper border and lower border and two surfaces, outer surface and inner surface. Let's come to the muscle attachment. On the upper border of SOaF, there is two leaves, outer leaf and the inner leaf. At the outer leaf, there is insertion of external intercostal muscle. Insertion of external intercostal muscle. At the inner leaf of the upper border of the SOaF, there is insertion of internal intercostal muscle and the intercostalis intimi. Now comes to the lower border. In this lower border, there is presence of costal group here. In the floor of the roof, origin of internal intercostal muscle attached here. There is ridge above the costal group here. This is ridge here. In this ridge, origin of intercostalis intimi muscle here.